Good morning, everyone. If you've still got Easter chocolate to get, well, go get in line, right? And I saw this yesterday, and I tweeted something out just talking about how much organization this takes. Now, I want to give some context. I've worked in places where doing this or doing something like this, organizing something like this, was done just for morale or for fun. It doesn't improve morale, and it's not fun. But things like this don't happen usually organically. If they happen organically, usually there's patience, and there'd be privacy issues and all sorts of stuff like that. But having a bunch of people line up and conga down a hallway, and I'll show you the video. Hold on, here we go. That takes coordination, that takes time, that takes somebody running around the office saying, oh, can you do this in a few minutes, 5 minutes, right? Okay, we'll see you in 5 minutes. We're all gonna line up and it's gonna be super fun. I've seen a bunch of stuff like this. I've seen coordinated police and fire people going to applaud hospitals. I've seen videos from inside hospitals. This is an Ontario hospital, Markham Stouffville, right? It doesn't seem like they're overwhelmed. This doesn't happen when people are like normal busy, right? Not because they don't love their jobs, not because they don't want to dance down the hallway, not because they don't want to have a little party in the middle of their shift. But because they're busy, because they've got other stuff to do, right? Because they're serious people doing a serious job. And I understand morale, blah, 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 blah. If you're busy, if you're overwhelmed, if your department is running off its feet and crazy, if we are justifying this lockdown and saying these people are heroes, what? This doesn't make a lot of sense to me. It doesn't work, right? The actions miss the words, right? It doesn't really make sense. It doesn't make sense. If you were busy, if you had a bunch of people fighting for their lives on ventilators, or people who were dying because of pneumonia, this doesn't happen, right? And yet here it is. Weird, right? CBC News is reporting, and I want to take you kind of on a little walk through history, a walk through revisionist history as well, because apparently Canadians wouldn't have backed strict pandemic measures in mid-January. No, of course not, because, well, nobody but like me and a few other people were paying attention. Even till mid-March, right? People weren't really paying attention. Not a whole lot until lockdown started and etc. There were people who were worried, people who were prepping, but the news was judiciously ignoring this, right? Anyway, here's the first one. This is published April 10th. Today is the 11th. Tomorrow is Easter. I hope you're enjoying your Easter weekend. Anyway, CBC News is reporting Canadian Military Intelligence Unit issued warning about Wuhan outbreak back in January. So what did the government know and when? And did they take it seriously? A small specialized unit within the Canadian military's intelligence branch began producing detailed warnings and analysis about the emergence of the deadly novel coronavirus in Wuhan, China, in early January, CBC News has learned. The medical intelligence, MedInt cell within Canadian Forces Intelligence Command is tucked away on the edges of the country's security and defense establishment. It is a mandate to track global health trends and contagion outbreaks to predict how they'll affect military operations, but its assessments are heavily influenced by reports from the Five Eyes intelligence partners, including U.S. military's National Center for Medical Intelligence, NCMI. For at least one of the country's leading intelligence experts, the fact that the unit was tracking the COVID-19 outbreak and reporting on it raises serious questions about information sharing within the federal government and its possible failure to heed early warning signs. The MedInt cell monitored the early progress of the outbreak in China and assessed how it could affect ongoing missions. We can confirm that the CF Intcom started to report on COVID-19 starting January 2020. Lieutenant Hire Karagzoga, excuse me if I got that wrong, a spokesperson for the military intelligence branch said in an email. The military unit, which is made up of specialists in public health, microbiology, biochemistry, emergency management, and clinical medicine, uses open source data, including World Health Organization statistics and analysis, along with classified intelligence from allies. Its use of classified information could be significant in light of reports coming out of Washington this week that U.S. military Medical Intelligence Agency was following and reporting on the novel coronavirus as early as late November, right? If we've got a team that's accessing the Five Eyes, it would stand to reason that they would start to hear about this in early November, right? If they're accessing the same agency and the same information as the Five Eyes, as U.S. intelligence, medical intelligence. It's interesting. Back to this. ABC News reported on Wednesday that that detailed NCMI briefings, which raised the alarm about the COVID-19 outbreak, were circulated multiple times among decision makers and policy experts in the Trump administration throughout December. They eventually ended up in President Donald Trump's daily intelligence briefing package in early January. Those assessments said the virus posed a serious threat to American forces in Asia and significantly claimed China's leadership knew the outbreak was out of control and that crucial information was being withheld from foreign governments and public health agencies. Karazogia, excuse me if I've got that wrong, said the MedInt unit works directly with its peer organizations but would not say whether those stark analyses made their way into the Canadian military's medical intelligence brief. We cannot comment on the contents of intelligence reports that we receive or share. Okay, so they knew in January. They were talking about it. The Canadian military intelligence were reporting about it in January. Here's another report published April 10th. Again, we're the 11th right now. Government documents reveal slow start to Canada's COVID-19 response. Bureaucrats were reluctant to monitor travelers from China, consistently claimed risk of COVID-19 was low. Briefing notes prepared by bureaucrats for federal ministers show just how quickly the COVID-19 situation evolved in Canada, with public health officials stating the risk of transmission in Canada was low right up until early March, only to recommend an ordered shutdown of economic life in this country some 2 weeks later. Prime Minister Justin Trudeau warned Thursday that it could be as long as a year before normal life returns in Canada, a dramatic change in messaging considering how Public Health Agency of Canada officials were advising policymakers less than 2 months ago that COVID-19 risks were low in this country and that mandatory quarantines for returning travelers would be too difficult to enforce. A March 10th department drafted briefing note prepared for Health Minister Patty Hajdu ahead of question period said that with just 12 cases being reported nationwide at that point, the risk of spread of the virus within Canada remains low at this time. The note also said the public health system is, quote, well equipped to contain cases coming from abroad, limiting the spread in Canada. A month later, Canada has more than 21,000 cases. As the documents show, as early as January 28th, the WHO was describing the risk of COVID-19 transmissions as very high in China and high at the global level. The tranche of documents prepared by various government departments and tabled with the Commons Health Committee late Wednesday includes many of the early planning memos that informed the federal government's response to COVID-19 in January and February. They show that while the government was seized with repatriating Canadians from China's Hubei province and various cruise ships during that time, there was little talk of a possible pandemic. Public health officials questioned the accuracy of media reports out of the city of Wuhan and Hubei, suggesting that the virus was spreading through person-to-person contact. Based on the latest information that we have, there's no clear evidence the virus is easily transmitted between people, a January 19 briefing note prepared for Hajdu said. The documents also reveal that the government was reluctant to strictly police travelers arriving from Hubei, the region of China where the coronavirus is thought to have originated. According to talking points prepared for a January 30th call with her provincial and territorial counterparts, Hajdu said preventing the virus from arriving in Canada was, quote, next to impossible because of the nature of global travel. What really counts is limiting the impact and controlling its spread once it gets here, the talking point reads. 3 days later, U.S. barred all non-U.S. citizens from China from entering the country. I scroll down a little bit. Between January 22nd and February 18th, 58,000 travelers arrived into Canada, from China. 2,030 of them were coming from Hubei province. Only 68 were pulled aside for further assessment by a quarantine officer, and only 3 passengers were actually flagged for a medical exam. The other 65 passengers were sent away with a pamphlet. It's impossible to know how many pre-symptomatic and asymptomatic passengers were released into the general Canadian population. On February 7th, the government started recommending that inbound Hubei passengers start to voluntarily self-isolate for 14 days to prevent transmission. In an updated memo to Hajdu, sent in mid-February, department officials warned that Canadians may question the effectiveness of voluntary self-isolation measures for those travelers, but the memo says there is no ability to enforce or ensure compliance with a mandatory isolation order without the use of the Quarantine Act, a measure the government would end up invoking weeks later. The memo said it was best to leave all self-isolation measures as voluntary to ensure that there is less pressure on the public health resources. The memo said that public health officials don't have the capacity required to quarantine passengers from China. 20,000 such travelers were arriving in Canada each week at the time. I scroll down again. By February 26th, when there were 78,000 COVID-19 cases in mainland China, public health officials continued to counsel Hajdu that public health risk within Canada remained low. A month later, there would be 1,000 cases in Ontario alone. Even after the number of suspected COVID-19 cases in Canada started to rise by mid-February, Canada's National Microbiology Laboratory in Winnipeg did very few tests, with most of them reserved for travelers from China. It is now understood that there is widespread transmission of the disease in Europe and in some U.S. hotspots like New York by this time. By February 17th, the national lab had run only 461 tests, a marginal increase from the 367 tests run the week before. By February 25th, Ontario and BC had provincial labs ready to test, but other provinces were still relying on sending samples to Winnipeg, a cumbersome process that made it difficult to identify and isolate cases in other provinces early on. And they say, we're going to learn from this ordeal. This is a study. This is a case study in how not to handle a potential pandemic. It has absolutely been mishandled from the start. The people advising Ms. Hajdu, the people allowing Ms. Hajdu to continue to propagate the misinformation that she's propagated. The same with Ms. Tam. We're just getting the information now to start wearing masks. We're still landing flights from infected regions, including China. It's incredibly offensive. And they have the gall to print this. On April 9th, this is 2 days ago, Canadians would not have backed strict pandemic measures in January, says official. Right? Sure we wouldn't. Closing the border and telling the public to self-isolate at home in the early days of Canada's COVID-19 outbreak would have done more harm than good, according to a national public health organization. I just want to point out how they're positioning the argument. They're not positioning the argument saying shutting down travel from infected regions like China, which we did not do, and putting an increased public health awareness plan into place and recommending masks in public. If they had done that in January, there may have been pushback on the masks, but the hand washing people would have done no problems at all. People are used to that in Canada anyway, and people get the flu, etc. But had that been done, had the shutting down of the borders and shutting down of Roxham Road and shutting down of flights in from China been done, maybe we would have been on track to do what Taiwan has done, which they have not shut down their economy, and we have. And that is, so this is just, the positioning of this argument is, again, putting it in such a way that you'll agree with the author, right? Of course you wouldn't have agreed to a public shutdown in January. There was no need to. That would have been a massive overreaction and not what was necessary to contain the outbreak at the time, right? What was necessary was stopping infected people from coming into the country and spreading it asymptomatically, which does happen with this virus. And that would have helped to stop the spread. But instead, the genie's out of the bottle. We can't go back now. Their incompetence made that happen. And this article is positioning it. So you'll agree with them. In fact, I'm not even, hold on, I'm going to double check that there's something worthwhile to read in this. Okay, I'm going to skip part of it, but the learned lessons part I want to highlight, because the learned lessons part is kind of tacit admittance that they've messed up. But I don't think that we should let them off the hook with learned lessons. This is complete incompetence writ large. Like, this is incompetence. They could have stopped this. Our economy was more important than landing flights from China, and yet they continue to land flights from China, and now our economy is shut down. There's a direct line from one action to the outcome, okay? Okay, back to this. The House of Commons Health Committee is studying Canada's response to COVID-19 virus to ensure the federal government learns lessons that can be applied to the next pandemic. Oh yeah, in 2120? Yeah, sure. The Liberal government has faced criticism for waiting until the eve of Ontario's March break to tell people not to travel. The Conservatives have accused the Trudeau government of failing to restrict public gatherings soon enough and waiting too long to impose tougher measures at the border. After critics accused it of lax screening at airports for returning travelers, Quebec Premier François Legault sent his own public health officials and police to airports to warn travelers to self-isolate for 2 weeks. This week, BC Premier John Horgan took it a step further and imposed a new legal requirement forcing travelers to present formal self-isolation plans to authorities at airports and border crossings. And I said at the beginning of this, I thought Doug Ford would act and the premiers would act before Trudeau acted, and that's still true. He's still not keeping our airports free of people landing from infected areas. Shutting the border and mandatory COVID isolation. Trudeau says nothing off the table. This is back in March 15th, back when they said this is going to get worse before it gets better, after months of saying the risk remains low to Canadians. It's no longer low. And look at what our economy is doing, right? A big explosion. Here's the Emergency Act. This was yesterday. Need for Emergencies Act rejected by premiers on call with the Prime Minister. I'm just going to leave it at the headline there. Basically, the premiers were kind of ticked off, and they've consistently said, we're not doing that. We're handling this just fine, and please stop the flights landing from international areas such as infected areas such as Huaibei, etc. China, period. House of Commons resumes sitting to pass wage subsidy bill. Again, this is just in headline, but I wanted to point out that had they done this right the first time, they wouldn't need to come back and do this. Justin Trudeau made promises that were not included in the original bill that they came back and they sat a reduced parliament to pass. And that was, people had to drive in 6 hours, 7 hours to Ottawa, people who were within driving distance, to get this emergency measure passed. And it wasn't enough. It was too narrow. It didn't cover enough people. So they have to do this again. I would hazard to guess that we're going to have to do this again because, I say again, the Liberal government seems to be completely incompetent, or they're doing this on purpose, writing bills that are not quite enough to have to come back and keep doing again. I don't know why they would do that, but there's a whole bunch of things that I don't know why they would do, but they continue to do. So I'm not going to speculate on why. I'm just going to say maybe they're doing it on purpose because maybe they are. At some point, like one mistake, two mistakes, you say, okay, you guys tried real hard. Right. But at this point, from lying to people about masks to landing flights to saying, oh, no, you guys wouldn't have accepted it anyway if we had tried. It starts to look like a pattern that's not just sheer incompetence. Right. It looks like maybe that's the plan. Right? Maybe that's what you're planning on doing. Here's another interesting one. National Post is reporting Canada looking to prepare surge force use cell phone data to contain COVID-19. Cell phone data? Yeah. I'm just going to read the cell phone data part. Federal and provincial health officials are recruiting small armies of staff and examining technology options such as cell phone location data as they ramp up Canada's capacity to do the contact tracing. We haven't done contact tracing at all, really. We haven't done it effectively at all. This is done basically to track the transmission and to stop spread, right? Oh, you've come in contact with somebody and you should stay home and whatever, and then that stops the spread. But we haven't really been doing that very well at all. And like it's out. They're saying it's endemic. That just means it's out in the community. It's like trying to contact trace the flu, right? It might work at first, but there's going to be a bunch of people who just get it and have no contact with anybody who's known to have it, right? And this spreads asymptomatically, right? You see the problem. Contact tracing involves searching out recent contacts of anyone who's tested positive for COVID-19 and monitoring those contacts for symptoms at the potential need for testing and self-isolating. It's key to stopping an uncontrolled outbreak in a community. Canada is still in its first wave of infections, and officials have said the best course of action for now is to have everyone stay home. But once the first wave subsides, likely sometime in summer, extensive testing and contact tracing should allow Canada to start reopening its economy and lifting some of the physical distancing restrictions. That seems too long, way too long. That's not summer, and I know they're saying July, but way too long. Not nearly good enough a plan, especially with hydroxychloroquine that treats this well. We could open tomorrow if we took that seriously or tested it appropriately. Back to this. As we get this wave under control, the absolute key is having sensitive systems to detect any new cases and then do rigorous contact tracing around those cases, said Theresa Tam, Canada's Chief Public Health Officer and constantly wrong information spreader, on Friday. Scroll down. Technology will also play an increasingly important role in contact tracing, but the Canadian health officials are still deliberating over the best course of action. Cell phone location data is central to that discussion and has been put to use in other countries such as Singapore, but it also raises thorny questions about privacy. I think this is an area of great interest to every jurisdiction, Tam said. There are many, many innovators with lots of different ideas, so we are putting together a group among the providers, or the provinces and territories to gauge interest. She said that along with contact tracing, technology could be used to send reminder alerts and about how to properly self-isolate. We need to look at each of these innovations in particular as it pertains to things like privacy, she said. An example of the type of sweeping technology power that could be put to use was announced on Friday by Apple and Google, the respected makers of iPhone and Android operating systems. Google and Apple are announcing a joint effort to enable the use of Bluetooth technology to help governments and health agencies reduce the spread of the virus, with user privacy and security central to the design, said a statement from the companies. The technology would eventually allow users to opt in to be notified if they've crossed paths with somebody who's tested positive for the COVID-19. Privacy, transparency, and consent are of utmost importance in this effort, and we look forward to building this functionality in consultation with interested stakeholders, the company said. There's already been an ongoing debate in Canada as privacy and civil liberties advocates debate what measures may be necessary and how to judge when a line has been crossed. We're sometimes inclined to think of the word surveillance as always bad, but of course it is not, said a recent post by Brenda McPhail at the Canadian Civil Liberties Association. Of course surveillance isn't bad, everyone. We're just gonna surveil you for a little while, okay? You see how this could potentially go bad? Oh, you've got COVID-19, sign this here and everybody will know, and blah, 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 blah. And then all of a sudden maybe people who don't have the virus but who are political ne'er-do-wells, or maybe people that, you just don't want to associate with. Maybe they start having a higher rate of infection, right? And maybe they start not being able to go into stores because they're infected, right? Here's armbands, right? They're looking at, CP24 is reporting, Europe ponders when to reopen. South Korea plans tracking armbands. In Asia, South Korea announced plans to strap tracking wristbands on people who defy quarantine orders. The Japanese government appealed to the public nationwide to avoid bars, clubs, and restaurants, broadening a measure announced earlier for 7 urban areas, including Tokyo. So, I think it's a slippery slope, especially when we've got police and the RCMP. While police to verify Canadians complying with the quarantine order, there's one. The RCMP said it had been asked by the Public Health Agency of Canada to help with national coordination and enforcement of the March 25th Quarantine Act that requires everyone arriving in Canada to stay home for 14 days. Officers will speak to those under quarantine and advise them of the potential consequences of non-compliance, the police force said in a statement that cautioned violators could face significant penalties, including fines and imprisonment. And then moving on to here, Toronto, this is April 3rd, enforcement of physical distancing ramps up in Toronto, right? Chief Mark Saunders tweeted, Toronto police officers are patrolling parks and public squares on horses, bikes, in cars, and on foot to enforce public health orders and a social distancing bylaw. Tickets will be issued for those not respecting the law. Enforced they did. Toronto police spokesman Megan Gray said police issued 21 tickets. The city hasn't said how many bylaw officers handed out. Moments after Ontario Premier warned that over 1,600 people could be dead by the end of April, police and bylaw officers had ticket books in hand at Humber Bay Park West. And the last one is man sought after car wash shot at in North York. This is this morning at 8 a.m. Toronto police are looking for male suspects in a silver car after a gunshot rang out in the Jane Street and Shepherd Avenue areas Friday night, striking cars and a nearby car wash. Toronto police say that at 10:54 p.m. on Friday, a caller phoned in to tell them a man was standing in the street near Jane and Shepherd Ave, firing a gun at cars with people inside. At least one vehicle's windshield was shot out. Somewhere between 5 and 10 shots were fired. No one was injured, but investigators were on the scene Saturday morning, collecting shell casings and making bullet impacts. Saturday morning, like it was almost 11 o'clock Friday night. 10 shots fired, and they were like, we'll get there soon. Don't worry about it, everybody. We've got bicyclists out today. They need to be told to wear their mask, right? Police have policing things to do. Did you hear about the hate speech on Twitter? So listen, leave the guy who's shooting up the street and the car wash alone, okay? He might have been in jail and maybe exposed to COVID-19, and that's why he's currently out on the street shooting up the street. There's so much wrong with the responses happening across the world. It looks a lot more like they're interested in these policing powers than they're interested in keeping people healthy and safe, right? The draconian acts needed to centralize power and all that stuff. It's very concerning. It's being bandied about. It's being talked about. And, I mean, still, there's time for conga lines, right? Isn't that weird? Thanks for watching, everybody. Check out CanadaPoly.com, check out CanadaReport.co, and have a wonderful, wonderful Easter.